One of the most common diagnoses we see in our urology clinic is nighttime wetting. Nighttime wetting is defined as the release of urine while your child is sleeping. There is not a single cause of nighttime wetting. There is a delay in the maturation of the communication between the brain and the bladder at night, which causes the child who's sleeping soundly to sleep through when the brain and bladder should be communicating. Wetting may also be in part due to a lower functional bladder capacity. It may also be due to medical conditions as well as psychological factors, emotional stressors that may be triggering the nighttime wetting. It is very important for you to know that this is not your child's fault. About 15 to 20% of kids age 5 are still wetting at night. That number decreases as the years go on. By the age of 15, only 1% of kids are still wetting at night. Without doing a thing, without any treatments, kids do outgrow this on their own. Nighttime wetting can cause a lot of emotional strain for the parent and the child. Children with nighttime wetting are often embarrassed and not able to attend sleepovers or camps that other kids their age are able to attend due to anxiety that they might wet at night. When you come to see us for the first time, we will have a discussion with you and your child regarding their daytime and nighttime bladder habits, as well as their bowel habits. We will review a voiding diary that should be obtained prior to your first visit. We will also do a physical exam, which will include palpation of the abdomen, inspection of the genitalia, and inspection of the back and buttocks. Every child is unique, therefore an individualized treatment plan will be developed by you and your provider at your first visit. One of the most common treatment modalities that we use for nighttime wetting is the nighttime en-you-ree-sis alarm. This is a sensor that will clip on the child's underwear and will recognize when the child starts to wet at night. This piece is the speaker that will sound once the child starts to wet. This will be clipped to the outside of their pajamas. The alarm will sound when the child starts to wet at night. At that time, a parent will have to wake the child up and send the child to the bathroom. The alarm works by reconditioning the brain and the bladder to communicate at night. If used consistently and correctly, the nighttime alarm will be successful for most children in 3 to 4 months. In addition to the alarm, there are other treatment options. These include bowel management, medication, and psychotherapy. Treatment of nighttime wetting requires determination, motivation, and consistency by both the child and the parent.